So,
Hi, I'm Jim Clyne. I represent LeadingAge New York. We represent the full continuum of care, of long-term care providers, including over 180 nursing homes. I fully understand the limits that the council faces in implementing the statute and also the department, but the reality is it's impossible for members to comply with these levels. Based on the latest data that came out from the federal government, 75% of the nursing homes in the state don't meet one of the three standards. Members are trying at an extraordinary cost through staffing agencies, through bonuses, through incentives. Many of them are also dealing with it by lowering their census. That's creating this healthcare crisis in New York that's happening right now. If you read the Times Union today, you'll hear about the EMS people waiting hours before they can get into the ERs, which are backed up because they can't get people up on the floors because they can't discharge them to nursing homes. Right now, there are 6,700 more empty nursing home beds. These are certified beds that are empty because you can't get the staff. And if you could get the staff and feel like you could run it safely, if you don't hit these arbitrary numbers that are not case mix adjusted, don't take in the rec and activity staff, you'll be penalized. And then you'll have even less money in order to try and meet the requirements. Mr. Thomas hit the nail right on the head when he said we are not going to be able to change the business model overnight. We really need the department in regard to this regulation to work with DOL and declare that there is an acute labor shortage and say something publicly that it is not going to change anytime soon. That's the only way you're going to get facilities to begin to open up and start taking more admissions. The ultimate solution to this is more money. It's the only solution. New York has the worst Medicaid rate when you compare cost of providing care to the revenue provided. 70% of the days covered are from Medicaid. There is no place to shift the cost, and because of the lack of increases over the last 14 years, we are way behind. We've had good discussions with the department about the allocation of the $187 million that's available, but just to give you some context, that's only 2.5% if it was spread across the board. Just to give you some context, Wisconsin just put up $500 million for staffing in nursing homes. Pennsylvania did 17.5% across the board. New York State stands out as an outlier in completely neglecting the funding of care, and that is hurting seniors. So I'd be happy to answer any questions.
Thank you, Mr. Clyne.